Physical disabilities and health problems. Physical disabilities, conditions that interfere with the normal functioning of bones, joints, and muscles. Physical disabilities, classifications based on body parts: diplegia, all four extremities; hemiplegia, one side of the body; paraplegia, legs only; quadriplegia, arms, legs, trunks, and head control. Spinal cord injuries. Spinal cord is injured or severed. Muscles below the injury do not receive messages from the brain to function. Spina bifida, imperfect development of the spinal cord in utero. Hydrocephalus, buildup of the fluid on the brain. Incontinence, lack of control over bladder and bowel movements. Muscular dystrophy, progressive weakening of the muscles. Duchenne's disease, affects only boys. Weakness begins at hips and shoulder and moves to arms and legs. Hip dysplasia, hip moves in and out of socket. More frequently found in girls and treated with braces. Juvenile rheumatoid arthritis, painful inflammation around the joints. Children should be encouraged to move. It often disappears by age 18. Implications: team efforts, physical therapist, occupational therapist. If there are language or hearing problems, speech, language pathologist, and audiologist may be on the team, parents and teachers. Psychologist if there are any behavior problems. Physical disabilities, adaptive equipment, mobility devices such as braces, walkers, wheelchairs, positioning devices such as wedge mats, bolsters, and prone boards.
Adapting materials, universal design for learning, recognizing that a one-size-fits-all approach to education does not work, understanding the need to design curricula to meet the needs of all classroom learners, believing all children who attend early education programs will be successful in development and learning.
Manipulative materials, wall displays, Velcro on blocks, pegs on puzzle pieces, creative materials. Use large pencils and paintbrushes. Push pencils through a ball for an easier grip. Tape paper to easel or table to prevent sliding. Self-help devices. Use Velcro instead of buttons. Make utensils easier to grip for feeding. Use suction cups for soap. Adaptions in the classroom. Wheelchair accommodation. Widen aisles. Put materials up on shelves, not on the bottom. Bathroom accessibility. Railings. Indoors and out. Place railings to help children with balance. Floor coverings. Carpeting is best if well stretched and securely nailed down. If no carpeting, provide non-skid crutches and shoes. Eye level materials. Place objects at the children's eye level for independence. Transitions. Appropriate amount of time for transitioning. Some children are chronically ill and live every day with serious health problems. Many developmental disabilities involve significant health risk and problems. Asthma. This is the most common and most serious. During an attack, a child cannot get a full breath of air. Lips and nails may turn blue. If a child cannot get relief from medication, emergency help needs to be called. Cystic fibrosis. Children have excessive mucus, chronic cough, progressive lung damage, and inability to absorb fats and proteins. They also tend to have frequent foul-smelling bowel movements and unusually salty perspiration. Hemophilia. This is usually only found in males. The blood does not clot normally, causing serious internal bleeding. Encourage children to be as active as possible without taking too many risks. Leukemia. This is the most common type of childhood cancer. Chemotherapy is the most common treatment. Sickle cell anemia, autosomal recessive disorder. Red blood cells are sickle in shape instead of round, making it difficult for them to pass through the bloodstream. Overall fatigue is one of the chronic problems. It is only found in African American children. Heart problems. Children with heart problems should be encouraged to move, but should not participate in anything too physically demanding. Monitor their skin color for a blue tone. Let the children tell you when they are too tired to continue. Diabetes. The body does not produce or properly use insulin. Insulin is a hormone that is needed to convert sugar, starches, and other food into energy needed for daily life. There are two types of diabetes, type 1 and type 2. Type 1 diabetes is caused by an autoimmune disorder. The body does not make enough beta cells to fight off infections. Type 2 diabetes is the more common. Hypoglycemia and hyperglycemia are the result. Hypoglycemia is excessively low levels of sugar in the blood. Hyperglycemia is too much sugar in the blood. When in doubt, give a form of sugar. Regulate food intake, monitor activity levels, watch for changes in behavior. Partial psychomotor seizures often appear like a tantrum. Child unaware behavior becomes stereotypic for that child. Medication is often prescribed. Be aware what to do during a seizure. Remain calm, cushion child's head, remove sharp objects. Do not put anything in the child's mouth. AIDS, caused by HIV, attacks a healthy immune system, leaving a person vulnerable to illness. Contracted through sexual contact, blood-to-blood contact, and infected mother-to-baby. Obesity. Not necessarily a disability, it can lead to poor self-esteem and other health risks. Child's caloric intake exceeds caloric loss through exercise. Increase child's movement and limit the intake of empty calories through unhealthy foods and drinks. Undernourishment. Children consume too few calories, causing low weight. It can result from poor chewing and swallowing. Increase easy-to-swallow foods and consult nutritionists for high-calorie, healthy food choices. Schools play a critical role. New dietary standards for school food programs. Centers for Disease Control and Prevention offers guidelines for schools to promote healthy eating and physical activity. Teachers should be informed of all health issues related to the child that may impact educational performance. Become educated on the illness, prevention, and care. Health records. These should be kept on all children and should include emergency telephone numbers, name of doctors and dentists, medications, allergies, immunizations. Administering medications. This varies from state to state, but most require the following. Parent permission. Child's name on the bottle with the dosage, medication log to be on file, locked up area to keep medication. Emergency considerations. Confer with parents and doctors to plan for a health crisis. Understand the cause of a crisis and frequency with which it is likely to occur. Learn how a child may behave before and after a crisis. Know what to do during and after the crisis and understand when to call for additional help. Confidentiality. Staff should be trained in requirements and understand the importance of working with families.